Hello friends, today we're going to discuss about assumptions in dialectical behavioral therapy. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I'd like to place this disclaimer. This presentation is for academic and training purposes only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss about the assumptions made in dialectical behavioral therapy. And this video is targeted to psychiatrists, doctors, nurses, mental health professionals, psychotherapists, and counselors. Dialectical behavioral therapy is a broad based cognitive behavioral therapy. Initially, cognitive behavioral therapy was tried for borderline personality disorder, but unfortunately, cognitive behavioral therapy short fell of providing care to them. Hence, dialectical behavioral therapy was brought in by Marsha Linehan for providing care for borderline personality disorders, patients with high emotional dysregulation, deliberate self-harm patients, and suicidal patient. And dialectical behavioral therapy was found to be very helpful in such patients. But however, before you know and understand about dialectical behavioral therapy, or if you want to become a dialectical behavioral therapist, you need to understand about the assumptions which are made. Without knowing the assumptions, you'll not be able to provide care to the clients such as who have emotional dysregulation, who are suicidal, who have deliberate self-harm, who becomes very angry very often. They do not engage in therapy. They may even give complaint against the therapist. Hence, before you enter into DBT, you need to understand these assumptions. If you are able to understand these assumptions, then learning dialectical behavioral therapy becomes easy. Practicing dialectical behavioral therapy becomes very comfortable, and also providing care to the patients like borderline clients becomes easy. Let's understand what is assumption. Assumption means a belief or a feeling that something is true or that something will happen although there is no proof. Here, we need to assume certain things in dialectical behavioral therapy. Without assumption, you will not be able to proceed further. Hence, all therapists who attempt to provide dialectical behavioral therapy need to learn about these assumptions. First and the foremost, in whatever condition the client presents himself to the therapist should assume clients are doing best. Then no one wants to suffer. They are struggling. In spite of having problems, painful emotions, they are doing their best. You should not say, you're not trying enough, which is done in cognitive therapy or in behavioral therapy. In dialectical behavioral therapy, you need to assume clients are doing their best in spite of their illness, in spite of their emotional problems, in spite of whatever disorder they have. This assumption is the first. Second one, in spite of all this pain, struggling, client wants to get better. They want to reduce their sufferings. That is what the dialectical behavioral therapy. That means in whatever situation and condition the client presents to you, you need to understand he has approached you or he has been brought by somebody else. That means they require help and clients want to get better. This is the second assumption you have to make. The third, clients wants to grow off their problem. That means they need to learn certain skills, tackle their emotional dysregulation, tackle their interpersonal problems. That means although the client is doing their best, although the client wants help, they require help through these skills training and they want to grow out of their problem. This is the third assumption you have to make. The fourth, client need to solve their problem irrespective of their origin. The client may not be at fault at all. The client having amygdala becoming hyperactive, at the same time, he is in a invalidating environment where the parents are highly critical, abusive, no support is there to the child. In such a scenario, the child will be going through emotional turmoil. Whatever is the cause of the emotional turmoil, the client need to solve their problem. That is the fourth. It is not that others are creating problem. It is the child need to become resilient and need to fight against all these things, and the client need to resolve all this problem by itself. That is the fourth assumption. Fifth, lives of the suicidal clients are unbearable. Whatever is the attempt, whatever it is, may be manipulative, it may be the person has done deliberate self-harm for attention. Here you're not going to look for the ulterior motive why they have attempted. You will just assume the client is going through severe pain. That is the fifth assumption you have to make. Any DSH or client, or any client who is attempting suicide, you need to consider it is a cry for help. Severe pain they are going through, and you need to assume that and provide care. Sixth one, client needs to learn skills to deal with their problems in all areas of their lives. Skill needs to be learned in the original environment. That means in DBT, very often they are not entertained or encouraged to get admitted. The skills are trained, individual therapy is done on OPD basis. At the same time, telephone counseling is also given so that the client learns the skill and applies in the original environment so that the skill generalization occurs. So, whatever he has learned in the hospital OPD, he will apply in his real life. Moving to the seventh, client cannot fail in dialectical behavioral therapy. Here, one of the best example Marsha Linehan gives. Imagine if a cancer patient is undergoing chemotherapy. Unfortunately, the drug does not work. What do you do at that time? What do you call? Do you call patient is resistant? Patient is manipulative? No, you say the cancer is resistant to the chemotherapy, or else chemotherapy resistant cancer we call it. Hence, even in dialectical behavioral therapy, you will say the therapy failed, or else the therapist failed in providing the care. Hence, client cannot fail in dialectical behavioral therapy. That is another very important assumption you need to understand and inculcate. You are not going to blame the client. But however, in such a scenario, the therapist will have high amount of emotional turmoil. He may have burnout. He may be stuck. He does not know what to do next. Hence, therapist needs support and guidance. Hence, there is a DBT consultation team. Without a DBT consultation team, DBT therapist should not venture into DBT. This DBT team will support the therapist, guide the therapist, and also keep the therapist in DBT framework. Marsha Linehan is very clear. Without DBT team, there is no dialectical behavioral therapy. Because if the therapist is not in the good frame of mind, if he is not accepting the client the way he is, helping the client to grow, and moving into dialectics, if he is unable to do that, that means he is going to cause more harm to the client. Hence, DBT consultation team is a must so that the therapist is supported. This assumption and also practicality has to be done. Ninth, observing limits, not boundaries. Invariably, in all psychotherapies, we maintain boundaries. But in dialectical behavioral therapy, it is the limits. It is the discrepancy between the client's demand and therapist providing services. Here, it clearly says that the client, whenever the demand arises, he can make phone calls to the DBT therapist, that is individual therapist. And it is between the demand and supply of services is what is considered as limits. It is between the two people and there is no boundaries. It is the limits. How much the therapist is able to provide care and how much the client demands. Hence, there is no boundaries, but limits are set here. So, DBT achieves all these goals using those assumptions. But what are the methods used? 4 important methods: individual psychotherapy, group skills training, telephone coaching, and therapist consultation team. These 4 important methodologies are used in dialectical behavioral therapy. To conclude, my dear friends, DBT revolves around dialectical theories and biosocial theories. Assumptions are essential in dialectical behavioral therapy, and those assumptions need to be understood, inculcated in dialectical behavioral therapy. And multimodal intervention is used in dialectical behavioral therapy, and they are the key to success in DBT. Thank you very much for giving your valuable time. Stay safe.